Hey, Dr. AJ here. A common complaint that I see in the clinic is erectile dysfunction, or ED. It usually goes something like this. A man will come in saying things aren't working like they used to. It's usually a gradual decline in function until it seems like one day, right when you need it, the erection isn't there. It's extremely common, and most of the time there are ways to improve function, but it helps to understand the cause of ED so the solution can be found. There are four main causes of erectile dysfunction that we're going to cover in this video. The first is called psychogenic ED. Psycho meaning psychological, as in a psychological cause for your erectile dysfunction. Your mental state is extremely important when it comes to getting and maintaining an erection, and things like stress, depression, anxiety, they can all limit your ability to get an erection. Studies have shown that stress decreases blood flow to the genitals, and interestingly, our brain and nervous system doesn't distinguish very well between serious life-threatening situations and the normal everyday stress that we go through. It responds similarly by increasing heart rate, increasing blood pressure, and increasing stress hormones. All these things put the body in survival mode and not in sexy time mode. So your body sees getting an erection as a low priority because it's just trying to survive. So when you're in survival mode, in some ways, your body acts as if you're running from a predator. Can you imagine trying to run for your life with an erection? So also, if things aren't going well in the relationship and there's stress there, that can be a common reason why things aren't working as well as they should. So doing things to relax and de-stress, like getting plenty of sleep, meditating, journaling, doing breathing exercises, and fixing problems in your relationship can definitely help with psychogenic erectile dysfunction. So psychogenic erectile dysfunction can sometimes come and go because one day you're in a good mental state, and maybe the next you're stressed out and you're dealing with a lot mentally, and that translates into poor function. And to add to that difficulty, once you see there is a problem in your function, it lowers your confidence and adds to the stress and can make the problem worse. The next cause of ED is called neurogenic erectile dysfunction. This is caused by a problem where the nerves aren't sending the right signals to the penis. This can be caused from multiple different things, like for example a spinal cord injury, multiple sclerosis, Parkinson's disease, lumbar disc disease, traumatic brain injury, radical pelvic surgery like a prostatectomy. In the case of surgery, sometimes the nerve is damaged or cut, or it could be from an injury or disease that affects the nerves in a different way. This is a difficult one to treat because we can't always restore nerve function. Sometimes the nerve is damaged or cut. In cases where function can't be restored, a penile implant surgery can be considered, so there is still hope for these cases. The third cause is vasculogenic erectile dysfunction. This means there is a problem with the blood vessels that causes difficulty in getting an erection. This is by far the most common cause of erectile dysfunction and is responsible for about 80% of cases. Things like high blood pressure, high cholesterol, smoking, and diabetes all can affect the health of the blood vessels. When the blood vessels become more stiff and more narrow, it decreases the ability of blood to get to the penis. This is something that happens gradually over years or decades, beginning in the mid to late 30s or 40s. ED can also be a warning for heart disease. The blood vessels going to the penis are only about 1 millimeter in diameter, so they show signs earlier than the heart does and have a very obvious effect when they start to have problems. All the heart healthy recommendations will also generally apply to erectile dysfunction and fortunately can help reverse the problem. These are things like getting regular exercise, losing weight, intermittent fasting, eating a heart-healthy diet like the Mediterranean diet or a low-carb diet, reducing sugars and processed foods, eating healthy fats and lots of vegetables, going in the sauna, getting your blood pressure and cholesterol and diabetes under control. All these things will help erectile dysfunction, but they may also save your life. Men with ED are at least twice as likely to suffer from a heart attack, stroke, or other cardiovascular death. The fourth cause of ED is iatrogenic. This means the ED was caused by the medical system, usually from a treatment or a procedure. I firmly believe that doctors do their best to live up to their oath to first do no harm, so they aren't intentionally causing erectile dysfunction, but it can be a side effect of certain treatments. Pelvic surgery, like we discussed, can sometimes damage the nerves to the penis, causing erectile dysfunction. An example of this is when they do a prostate removal surgery. They try to avoid damaging the nerves, but it can still happen. Other possible causes are certain medications that your doctor prescribes, certain blood pressure medications, can do this, like thiazide diuretics and beta blockers. Those are common and well known to cause ED. Other medications include antidepressants, antihistamines, opioids, metformin, tranquilizers, Parkinson's disease medications, anti-inflammatories like ibuprofen, muscle relaxants, and others. It's important that you do not stop taking your medications if you suspect they are causing ED, but rather have a conversation with your doctor about an alternative medication option, or even a better option is to talk to your doctor about the kind of lifestyle changes you can make to improve your health and have less of a need for medications in general. So these are the 4 main causes of ED. It's important to understand the main causes to be able to prevent or treat ED so you can enjoy healthy sexual function for your entire life. Thanks for watching. Make sure to subscribe. Have a great day and stay strong.